Oral TRT options. Are they good? Do they exist? And what are the results? Currently, there are 3 options on the market available right now. It's Jatenzo, it's Tlando, and it's Kyzatrex. And all 3 of these options are testosterone undecanoate. Now, when you historically think about an oral anabolic agent, an oral form of testosterone replacement, the first thing you think about, well, for most people, the first thing you think about is it liver toxic? Is it hepatotoxic or not? Well, these options actually are not hepatotoxic at all because they're actually absorbed via the lymphatic system. This means that it bypasses hepatic metabolism, and therefore you don't have to worry about it causing any kind of harm on your liver whatsoever. But the $1,000,000 question, are these forms of testosterone replacement, are they good? Are they legitimate? And what kind of results do they yield? So the first one I'll take a look at today is Kyzatrex. And this is oral testosterone undecanoate like the other ones are. And this one is produced from Marius Pharmaceuticals. Now, the dosing strategy for this one is recommended to do 100 milligrams twice a day with a max dose of 400 milligrams twice a day. And it's ideal that you take it with food. It'll help with the absorption, or so they say. And it does come in various size capsules, 100 milligram, 150 milligram, and 200 milligram capsules. But here's what I wanted to come here for. This is what it shows you after 3 months of being on the medication. These are the average testosterone levels produced. So it looks like most people are roughly about 300 to about 600. That seems to be about the average range. Obviously, there's some outliers here, but 300 to 600 is kind of the ballpark where it keeps people at. Given that the drug label reports a 2-hour half-life, you can kind of see that there are a little bit of peaks and troughs throughout the day while on this medication, which is to be about expected given that. So the next one we are talking about is Tlando. This one too is also testosterone undecanoate, and this one's claim to fame is that it's a fixed dose. It's 225 milligrams taken by mouth with food twice daily. So my supposition is that their claim to fame is that it's easy for providers to prescribe it, especially providers who know little or nothing about testosterone replacement, which is the vast majority of providers, quite frankly. So this is appealing for them. If you're a provider and a rep comes to you and says, "Hey, want to treat low T? I know it's real important. I know it's some hot stuff." Write this script. This is easy. You simply write the script. They take 2 capsules a day. There's no dosage titration whatsoever, which is easy. So it can be very appealing for the provider who wants to treat TRT but has no clue how to treat TRT. Also, like the fact their website compares to Tlando, it shows all these benefits of it, and it compares the every 2-week injections, which, as you should know by now, that's completely antiquated as well. So let's look at the results. Tlando, it's saying that on average, the patient's blood testosterone, their levels will be about 476 nanograms. Again, not that impressive to be quite frank with you, because a lot of patients start TRT with ballpark numbers like this. And the last one we are talking about today is Jatenzo. This one is also twice daily dosing with food. This one has some interesting looking dosing schemes. 158 milligrams twice daily, 198 milligrams twice daily. The recommended starting dose is 237 milligrams twice daily with food. So they do have interesting dosing schemes, but they recommend picking one of these numbers and just doing it twice daily and not really mixing and matching with it. So let's see what the numbers look like. So with Jatenzo, the average serum testosterone level achieved on this medication was 489, about 10 points higher than Tlando's. And it said that about 94% of all patients that were on the medication, their levels remained under 1500. Again, with the average being just shy of 500. So again, nothing too sexy, nothing too impressive. But for people that want an oral option, this is just another one out there. And lastly, they looked at free testosterone. The free testosterone average achieved was 11. So, take it for what it is. What's the final verdict? What's the final word? Well, I still think that injections and compound cream, especially transscrotal application, I still think those are two top dogs. Those are the kings. Now, does this have a place, or is there a patient type for this? Obviously, there is, because companies wouldn't make it. And most likely, that patient archetype is one who wants to stay in the insurance model. They're not too worried about driving their T levels high, and they would have to have severely low testosterone levels. So you'd probably be somebody that's sub 200, in the 100s when you get on this, because again, we've had patients start TRT at levels that this can kind of peak you at.